20 years of war in Somalia have left the healthcare system in crisis. The majority of Somali families do not have access to maternal and child health services or nutrition services. High levels of communicable disease, lack of access to clean water and sanitation, and inadequate emergency obstetric and newborn care services mean that every single hour, 8 Somali children die before they've reached their 5th birthday. Somali mothers also suffer as a result of the collapsed health system. Every 2 hours, a Somali mother dies due to preventable pregnancy and childbirth complications. Since widespread conflict ended in Somalia, the country is on the road to recovery and development. As part of this effort, the government and the United Nations, together with international development partners, are starting to rebuild the health system with a joint health and nutrition program, focusing first and foremost on improving the healthcare status of women and children.
The Joint Health and Nutrition Program is our biggest development program, and it seeks to tackle these statistics face on and save the lives of thousands of Somali women and children. It is very important that the program for the government, because it also invests in our health system and our health workforce. The program allows the Somali authorities to decide on our priorities and our needs, and also gives us the tools that we need to be able to manage and lead the health sector in the future.
The Joint Health and Nutrition Program already gives 3.6 million Somalis a free essential package of health services. Rural and urban populations have free access to prenatal care, professional midwives and doctors for delivery, postnatal care, immunizations for mothers and children, nutrition programs, disease prevention and monitoring, adolescent health care, and family planning in their communities.
So in here we save lives, alhamdulillah. And here, if there isn't any health facility, mother deliver without treatment, with no qualified midwife. We have a qualified midwife who works with the mother very well. We have drugs, good instruments to deliver. Also, the baby, we give the immunization at birth. All facilities that can save mothers and babies' life, we have.
miisaankeed ku hore saayida u liitay iyadana tacbaan ay ahayd maantana miisaanka ku hore soo gashay 5 kiilo 4 kiilo amla soo gashay maantana waxay maraysaa 7 meelaha maraysaa saayida u liidatay maanta la keenay maanta alxamdulillah waa fiican tahay adwa fadhiista biskada hada waa cunaysaa ku hore biskada suumanada ma sha Allah ayuu alxamdulillah ronta hawsha kuwa aan keenay way jirtaa oo ilmo saa'id u liitay oo hadda ilmo ma sha Allah u naqday aan soo tilmaamay kuwa ka seen aan keenay jirtaba oo meesha la keenay kuwa aan arkan waa u soo sheegay waa imaadan.
The first month total cases were 300 cases. Then it increased gradually month by month. Now on November our total cases were more than 2,000.
Hello, man. Take it. Burger is good. Oh. ما يستدل ونحسن بعض يا دقوي مني كي عفمات كده لا سعدان طلع لذا سدا وحيابها بند عفمات لا سعدان عفمات يستدل هو باقي مني إن شاء الله ويمني ونمني ولا صح دري يا مرول ما هو فهمي يعني سبب هذا ويلكم ولو شيء جيا إن عفمات في عيني الماء يا دقوا بس هاد ولا نكون يا مرول بالماء طلع لا حرمها عفمات كتجا ها مرول بنا نكون سادت وان تغنا ده ونصعنا أنا عفمات كوفي هاي.
And we are receiving feedback from the Somali community everywhere that it is working and they want it to be continued. So we would like the international community, United Nations, donors, everyone to contribute, because this looks like to us that it will bear fruits, it's working, and it will contribute to to provide services for every Somali wherever they are.